Hello, fellow chiropractors. This is Dr. Joe Borio, this week's Thought Flash. And very excited to be here with you guys today. I wanted to share some good information with you, really more on kind of the practice management side of things. We've been focused a lot on philosophy, and I think that's vital, but I got a lot of questions on practice management. I'm going to talk about today just the table tick, the table talk, if you will, in your office. I've talked about this before, two things. I hear it referred to as chiropractors need to dip themselves. I don't think chiropractors need to be dipped. We need to be submerged in chiropractic principle for your entire career, hopefully your entire lifetime, if the passion stays with you. But your patients are going to be dipped. And you guys got to remember that the average person, when they walk in your office, most likely is the first time they've ever been to a chiropractor. And if you're a principal chiropractor, it may be the first time that they're actually getting the principle of chiropractic. So that means that they've never heard of innate, and even if they don't understand that word necessarily, they never really been shared the concept that their body understands how to heal, and that healing comes from within, and that their body knows exactly what to do all the time as long as that life force, life source is functioning and expressing itself through the body all the time. So that's not something they understand. Their understanding is, I do what I want, I eat what I want, I treat the body the way it wants, and if something fails me, if something starts to hurt, if I get sick, I get a cold, a sniffle, whatever, I got to start putting stuff in my body because that's what they've been educated with. They're educated most likely out of fear, that they don't know that their body has that ability. So they think they have to take the antibiotic, or they have to swallow down the pills or the drugs or whatever, or they're going to die. You got to understand, it's very fear-driven. So your job in education is really empowerment. You're trying to empower the people that walk through your door so that they have some new sense of understanding and courage and calmness in their new choice of, hey, listen, this fever is okay in my child, and it's called leukotaxis, and for every degree of rise in body temperature, my white blood cell activity doubles. And therefore, my child's body or my body is doing something very good, miraculous. It's actually trying to fight off the infection. And my best thing that I could do for my child or myself is to nurture the natural response, allow the body to be capable or to work the natural response as well as it can. And that's going to certainly involve chiropractic care. It's going to involve those wonderful hands that God gave you, so you can put your hands on those awesome people that you serve and adjust them so that their nervous system works better and their body works just like it's intended to work. Now, how are they going to get that? They're not going to get it unless you talk to them. They're not going to get it unless you explain it to them. How often do you have to do it? Forever. You know, I have clients come in and, wow, you know, I kind of say it once like they're going to get it. It never ends. Listen, when you're in your office, you're essentially a teacher, right? The word physician means teacher. Your job, I'm looking at my clock over here, your job as a chiropractor is to teach them all the time. Listen, when you're adjusting people, it's not time to talk about the baseball game or the weather or the Yankees or the Boston Red Sox. You know, I'm out in New England here. Or, you know, the Tiger Woods fiasco or whatever. It's not time to talk about that. What it's time to talk about is chiropractic. And when I say chiropractic, what I'm talking about is the body and how it functions and how awesome it is, how wonderful it is, and how it has this ability to heal and regulate and function. And that's what you need to talk about table to table to table, not anything else. And that doesn't mean, you know, I'll never have a laugh, or somebody won't share a funny quick story with me, or, you know, somebody will pull you off point a little bit. I'm not going to say that never, ever, ever happens, but 99% of the time you have to stay on point. Couple of tips to stay on point. Your health handout. We have a health theme of the week. We review it with my staff in the morning on Monday, and that theme stays in all week long. This week was on lung capacity and how it's improved with chiropractic care. So that's something that allows you to stay on point. So if somebody starts to bring you off point during the office, during the day with like I said, a joke, or they start talking about weather, all you got to say is, hey, Bob, that's interesting. Did you read this week's health handout? And boom, you just pop it right in front of them, or you direct their attention to it, or you hold it in your hand, and it just brings you right back to chiropractic. Really important. You got to remember that for the, like I started talking about, when they walk in, they've never really had the understanding of the body's ability to heal. So knowing that every moment you spend with them is really precious, it's really, really important, Because when they leave, they have what I always call sabotagers. They have their mother, their father, their uncle, their aunt, their sister, their cousin, a coworker. You know, what do you keep going to the chiropractor for? What are you doing this for? What are you doing that for? And all of a sudden, that stuff starts to get in their head, and they start to question what it is you do. So every time you are with them, it's like that seesaw. It's like that scale. You're constantly trying to weight the scale towards wellness, lifetime family wellness, because the rest of the world is outside in, right? The rest of the world is going to want to lean them this way. You're going to have to try to constantly lean them back to the wellness side. And that means every time that you talk to them, it has to be chiropractic in philosophy and in nature. We have 10% of people are going to really hit you with some symptoms or really hit you with some questions. It happens in our office too, probably a lot less than most, but we still get that. And then what do? How do you get them on the table? You got to have some, you have to have some tools in order to get them down, right? Because and I say this all the time during my events, but I mean, how many more times can you hear sciatica explained to you, you know, or the herniated disc, you know, syndrome, right? And all they're thinking is their problem is their leg pain, when I'm thinking, wow, that area goes to the prostate, goes to the large intestine, and it's going to affect their bladder, and that whole area is really sick, so that means all that vital information, that data that your brain is sending down to those organs isn't getting there, so that whole bottom area of their body is getting sick and diseased. And they're just thinking about their back pain. So you need to talk to them about that. And you need to say, hey, listen, if I'm the engineer of the human body, right, and I'm designing it, how best would I tell this person, if I'm designing the body, that they have a problem in their spine? I'm going to put pain endings in there. The pain endings don't mean that, nerve endings don't mean that the problem is their leg pain. It's their body's way of saying this area of the spine is very sick, and therefore the messages and data that are trying to communicate to those organs isn't getting there, and the body's not working as well as it's supposed to. So that's the way that you need to talk. We do a lot of high fives. We do a lot of hugs in our office. So when I adjust somebody, you know, I'll tell them, Bob, that area goes to the pancreas, and that area moved really well, so that means you're going to get better information. That's going to help you regulate your glucose levels better and digestive enzymes better. Real happy about that. Awesome adjustment. I'm going to see you on Wednesday. Have a great week. And remember, let's talk to some people out there, some of your families. Let's talk about getting them in this week, okay? Boom. You know, remind your wife. She had missed her appointment on Wednesday. It's important to get her in this week, so make sure you mention it to her. We'll make sure we give her a call. You know, whatever that conversation is, but it never ends. When people start complaining to you and they come in the office, they're hitting you with a lot of symptoms. You know, Barbara, that concerns me. That's a significant concern to me. Don't blow them off, but then you also don't want to do a mini evaluation and exam on the table either, right? Doing all these mini ortho tests and evaluations. Why bother? I mean, if you've done an X-ray, they certainly didn't get into a car accident or fall off a roof, or they're not, you know, they're not having any type of systemic other disease that you're aware of. Certainly, if you did your initial clinical, then at that point, what are you going to do? You're going to adjust them. So get them on the table. You already know what's wrong. You already know they're subluxated. They're going to need care. Get them on the table. Barbara, that concerns me. That's significant, and I want to take a look at you. Get down on the table. Yup, you know, palpate that area. Identify where it is subluxated. Make sure you're using some real great clinical chiropractic assessment to ensure that you know that that area is subluxated or sick, so you're adjusting the right area, and then you're going to put them in position and do your adjustment to allow what? Not to get their back pain away. You're going to adjust them so you can improve the nerve function. You got to remember, don't assess them all the time in their symptoms. Assess them in nerve function. Body's going to function better, not feel better, function better. Okay? We're out of time, guys. Listen, this has been Dr. Joe Borio with this week's Thought Flash. We've got a great lineup in November 5th and 6th. We've got Tom Culleton coming out to Orlando, Florida. And he is a functional neurologist. He's going to talk all about chiropractic and neurology and the awesome things that we do with our adjustments. We've got another great event coming up in Vegas in January. We've got another great event at Cal Jam with Billy DeMoss in February 2011. Anybody that comes in on our Thought Flash for our Orlando event gets half prices, $47. And I would always ask that you bring somebody else. By all means, drag as many people as you can to these events. Let's try to change the world and move the needle of chiropractic so it becomes the premier health choice of America. We'll certainly change the health of the entire world if we can do that. Guys, listen, have a great week. Serve the masses. This has been Dr. Joe. Remember, may your innate flow from above down. Have a great week.
My best friend gave